In this video, we're going to give you an introduction into bowel management, and we'll discuss common challenges that people have after their injury. The learning objectives are listed above. We're going to help give you an understanding of the anatomy of the bowels. We'll discuss some difficulties you might be experiencing, and we'll talk about the impacts that your level of injury will have on what your bowel program will look like. To start out, we'd like to give you a baseline understanding of how the system works. The various color sections that you see here are all a part of what we call the large intestines. What we need to pay attention to here is this area called the rectum and the anus. The colon and the rectum are the areas where the food waste is stored until we're ready to have a bowel movement. The food waste can also be called stool or poop. The anus is surrounded by these muscles called the anal sphincter muscles that control the opening and closing of the anus and allows us to release the stool from the rectum. With having a spinal cord injury, you may have lost feeling or sensation of when you need to go to the bathroom, and also control of those anal sphincter muscles. When the nerves that are responsible for this are damaged, then your colon is not able to store or move waste as it should. When this happens, it's called neurogenic bowel. A neurogenic bowel can cause constipation or accidents, which has been shown to significantly impact the quality of life. A neurogenic bowel may also cause a loss of control of bowel movements, which is sometimes called incontinence, or decreased sensation or loss of feeling of when you need to have a bowel movement. And with that loss of that alarm bell signal, letting you know you have to use the restroom, you can have accidents. It can also cause diarrhea or constipation, or also leaky stool. Constipation occurs when you have any two of the following. You could be straining really hard to use the bathroom. You could have hard stools. You might have a sensation of not being finished and like you still have to go to the bathroom even after you've had your bowel movement. You might have a sensation of a blockage. And if you've had fewer than 3 bowel movements a week, then any two of those following criteria would mean that you're constipated at that time. You can work with your healthcare team to figure out what works best with you when you're dealing with constipation. Some tips and tricks that we have is that the optimal time for a bowel movement is within 2 hours after eating. This can be done in the morning or at night, but doing it within those 2 hours of eating allows you to take advantage and use the natural reflex of the body to pass a bowel movement after eating. In addition to an injury to the nerves that affect your colon, there's oftentimes weakness or paralysis of the legs and the core muscles. This can make it difficult to sit on a toilet. Some approaches or techniques that might be used to help have a bowel movement might be digital stimulation of the rectum, where a healthcare provider will insert a finger into your bottom and gently push against the rectal wall. You can also provide abdominal pressure. You can make changes to your diet, including consumption of the appropriate amount of fibers, fats, dairy, coffees, and tea. And you can also use things called suppositories and enemas, but some of these techniques we'll talk about in a later video. Bowel incontinence is the loss of voluntary control over our bowel movements. Our goal is for you to develop continence or the ability to have a bowel movement when you want to have one. When you can't hold in your bowel movement or poop because of your spinal cord injury, we need to time the bowel movement using our new approaches. General tips for a successful bowel movement include having easy access to a commode or a toilet. This might be a bedside commode. Larger meals stimulate a bowel movement. So eating a large meal when you know you will be doing your bowel program is an excellent idea. Spicy foods, fatty foods, caffeine, and alcohol can all increase stool frequency, which may be helpful for you or may lead to bowel movements too often. Doctors and therapists will talk with you about different approaches to managing bowel incontinence, including management of the volume of stool and the frequency of bowel movements. Certain medications you might be on can increase stool volume, decrease stool frequency, and slow down bowel motility. There are 3 different common presentations of neurogenic bowel after a spinal cord injury. These include an upper motor neuron injury or reflex bowel, a lower motor neuron injury or flaccid bowel, and also what's called a mixed presentation. If your spinal cord injury is above the level of T12, you will have a reflex bowel. A reflex bowel can result in a tight anus and a spastic colon. Common issues include constipation. If your spinal cord injury is below T12, you will have a flaccid bowel. A flaccid bowel results in a loose rectum and colon. A common issue includes accidents because the stool or poop is not being held in. The consistency of your stool is very important so that you don't have too frequent of bowel movements and that you can manually remove the stool. There are differences in the type of bowel management that would be performed based on if you have an upper or lower level injury. Moving forward, please select the video to watch that is applicable to you, meaning that if your injury is above T12, you would watch the upper level injury video, and if it's below T12, you would watch the lower level injury video.